Good morning, everyone. Today, Sunday morning, we have a very important topic to discuss with pregnant females, especially pregnant females who are thinking of getting pregnant, who are pregnant, and who had deliveries. एक myth, एक fact जो लोगों को clear नहीं है about painless delivery. So I am Dr. Gunjan Bhola. I am working as an associate director in Cloudnine Hospital, Faridabad. So, Aj, I have with me a very dear friend of mine and a colleague, Dr. Neeti Batra. She has an experience of almost 18 years in anesthesia and has been giving epidural anesthesia or analgesia every other day to the patients. So let's discuss with her few myths and facts which are related with painless delivery. So before we start painless delivery, I would like to discuss the physiology of a normal labor pains. नॉर्मल लेबर पेन्स एक नॉर्मल फिजियोलॉजिकल प्रोसेस है नॉर्मल फिजियोलॉजिकल प्रोसेस है देन द क्वेश्चन इज कि हमें पेनलेस की रिक्वायरमेंट क्यों है सो व्हेन एवर जब आपको पेन्स शुरू होती हैं कंट्रैक्शंस आती हैं यूट्राइन कंट्रैक्शंस आती हैं तो वो पेनफुल होती हैं बिकॉज ड्यूरिंग दैट टाइम पीरियड वो अकॉर्डिंग टू विद पेन जो हार्मोन जो देता है ऑक्सीटोसिन जो कंट्रैक्शंस कराता है उसकी वजह से ही यूट्रस के माउथ की डायलिटेशन होती है विच इज रिक्वायर्ड फॉर अ नॉर्मल डिलीवरी टू हैपन पर हर एक इंसान की अपनी अपनी पेन टॉलरेंस है बिल्कुल ठीक कहते हैं जो आपके सारे बड़े लोग भी कहते होंगे कि हमने नॉर्मल डिलीवरी में कोई पेन की दवाइयाँ नहीं ली तो आपको लो पेन के लिए दवाइयाँ पहले तो ये समझना है कि वो पेन रोकने की दवाइयाँ नहीं हैं वो आपको हेल्प कर रही हैं ताकि आपको पेन कम फील हो सो देर इज अ डिफरेंस इन इट योर लेबर इज डजंट गेट हैम्पर्ड विद अ लेबर एनर्जीजिया एनर्जीजिया का मतलब लेबर की पेन को महसूस कम होना उसके लिए कुछ ऐसा करना सो इनिशियली देर आर थिंग्स लोग बहुत सारी एक्सरसाइजेस करते हैं बिफोर डिलीवरी ताकि उनकी लेबर पेन इजी रहे उनको लेबर पेन्स कम फील हो लेबर का ड्यूरेशन कम हो जाए एवरीथिंग हेल्प्स इन दैट मैटर ऑल्सो बट आई हैव सीन पेशेंट्स हु आर वेरी कमिटेड टू हैव अ नॉर्मल डिलीवरी कि हमें नॉर्मल डिलीवरी करानी है नॉर्मल डिलीवरी करानी है आई फाइंड पेशेंट जो सेकेंड थर्ड मंथ से शुरू हो जाते हैं कि मुझे नॉर्मल डिलीवरी करानी है बट एट द टाइम ऑफ लेबर पेन जब वो शुरू होती हैं बिकॉज ऑफ इतनी इंटेंस पेन है इट इज काइंड ऑफ अ पेन जिसको कहना बहुत आसान है फॉर अदर पर्सन कि आप बेयर करो उतनी पेन टॉलरेंस कई बार हम नहीं कर पाते एंड मोस्ट ऑफ द पेशेंट दे जस्ट गिव अप बिकॉज दे डोंट नो द ऑल्टरनेटिव or they don't know the alternative or they have very less information about this procedure so abhi the purpose of this talk is why it is more of an informative talk because we have an expert with her so she will be telling us कि what exactly is the reason लेबर पेन में अगर हम एपिड्यूरल देते हैं या जो भी पेन के ऑप्शंस देते हैं वो कितने सक्सेसफुल हैं सो नीति माय फर्स्ट क्वेश्चन टू यू इज के व्हाई पेन रिलीफ इज इम्पोर्टेंट in a patient who is insistent on having a normal labor in her pregnancy.
Hi, good morning, all of you. So first of all, I'd like to say that this is a natural method. The vaginal method is a natural method of delivery, and effective pain relief is very important for a good psychological and physiological development of the baby and for the mother. It's like a fear, pain, tension, emotional anxiety syndrome that is going on. Because depending upon the threshold of every woman, there is a pain threshold of every woman. And it's a natural, I think it's a right of a woman to have that pain controlled. Anyhow, she is going for a natural delivery, and this is just a pain control method of delivery. It's just that it's an effective pain relief that is helping in the a better psychological development of the mother to have a good mother and child after delivery.
So can
So
you
this is
tell
a
me
natural method only.
can you tell me नीति कि ये कब से the pain relief mechanisms have been there and what are the different types of mechanisms which can be used?
Yeah, if we see in the history, we see that after 19th century, in the early 19th century, it has started. Queen Victoria took for the eighth child, she took chloroform for the painless labor. Then it was a twilight sleep. Then in the early 19th century, the epidural came. And there are pharmacological and non-pharmacological methods of painless labor. In the non-pharmacological methods, there is deep breathing, Lamaze method, then water birth, transcutaneous electrical nerve stimulation, then a good emotional support, massage, and hypnosis is there. Even acupressure is also there. But the gold standard is the epidural that comes in the pharmacological method. And among other pharmacological methods are your opioids that has been given through the intravenous route. Then it is the epidural. Then there are the other various methods of the epidural. But the gold standard, I will say, it is the epidural. And we can also give the Entonox, that is the inhalational method of giving nitrous oxide. But the best thing is epidural.
Yeah, but Equinox has a side effect of
Yes,
making the patient sick and nauseated and drowsy. So, and
yes,
anyhow, it's an inhalational thing. So, can you tell us briefly
yes.
about what exactly epidural? What is epidural and how does it work? क्योंकि usually patients को बैक में इंजेक्शन देखने देने से ही एक मिथ शुरू हो जाता है कि पता नहीं अब मेरे साथ क्या हो जाएगा.
Okay, first of all, I'll say that this is the injection which is given when there is the patient demand. Whenever you come in the labor and whenever you have been started with your labor pains, and when your gynae said, yes, you are in the labor, then you have got a right to ask for a labor epidural. Okay, and then this injection is given at your own doorstep. I mean, at your own room. You have been given the labor epidural and you are placed on your own bed, and it is given into the back after making a small area numb into the back. Then we give the procedure through the proper needle, and just it's a 10 to 15 minutes procedure. And after giving the drug, it acts after 15 to 20 minutes. So we just pass a needle into an epidural space that is around your spinal nerves, around your spinal cord. So it is not hampering and damaging the spinal cord. Then after passing the needle, I put a very small, thin plastic catheter into it that gives a continuous medicine throughout your labor. And even if you want another day of pain relief, then also. And your needle is removed, and that with tape, that catheter is fixed on your back so that I can give you continuous medication throughout your labor pains to make you comfortable throughout your labor.
So it
And
doesn't
whatever
puncture
things are being
spinal cord.
done,
So it doesn't puncture
no, we
spinal
don't
cord.
puncture the spinal cord.
So
No,
that is one of the myths people have कि वो मेरी spinal cord में चला जाएगा, मेरी nerve पे effect आएगा,
yes,
मेरे को कुछ effect रह
yes.
जाएगा. So to make things simpler, we have slide. I think आप उसको देख के you will be able to tell them better. Second.
Yes. So the benefits are it reduces the pain and discomfort of labor.
So yeah.
Now you
Can you
can see
explain?
that in this space, yeah, into this slide, you can see that my epidural needle is being placed outside the spinal cord, and after that, the catheter is being passed into the epidural space. So we are outside the spinal cord and outside the spinal nerves.
I think this answers many of the queries because they really confuse it with the spinal anesthesia and epidural. So can you please tell me इसमें से spinal जो है वो इससे जो green area दिख रहा है इससे आगे जाना is the spinal cord वाला spinal space में आप जाते हैं?
Yes. Yes. If I need to go into the spinal space, I'll puncture further and then I go into the spinal space. We have got certain other variety also that if we go for the combined spinal epidural anesthesia, in that case we puncture, we give low dose, and we further give top up with the epidural anesthesia. And it is also called the walking epidural because in this case we are giving very low dose and the patient can walk around. Even though we say that there should be some support, some supporting staff with the patient so that the patient is not left alone. Patient is taken to the washroom along with some support, and there's a continuous of the patient blood pressure, and also there is a baby monitoring that is going on continuously.
So usually जब आपने एक बार epidural उसको दे दिया patient को, usually we advise the patient in active phase of labor because latent phase में उसको beneficial नहीं है. So 2 to 3 centimeter, 3 centimeter plus patient हो जाए when the contractions are there. We advise the patient if the patient is not able to tolerate pain कि आप epidural का option ले सकते हैं. So what are the contraindications of an epidural analgesia? कौन से पेशेंट्स हैं जिनमें
Okay.
हम नहीं दे सकते?
Yes, the absolute contraindication is patient refusal. There is a bleeding disorder that is going on. Patient is on blood thinner. Because of that, there is a coagulation profile. That is the bleeding parameter that are being checked. That profile is being altered, and there is a sensitivity to local anesthetics. And there are certain relative indications, like there is a patient is having back surgeries being done. There is some neurological defect because of the back surgery, or back pain is already there, or there are the patient that who have got low platelet count, and there is a maternal hemorrhage that is already going on, or there is a sepsis that is there. So in all these cases, there is a relative contraindication that we don't advise the epidural.
So one of the myths that I would really like to ask you, it's a myth or a fact कि एपिड्यूरल लगाने के बाद में सिजेरियन के चांसेस बढ़ जाते हैं.
See, there's a lot of been studies, lot of random controllized trials that have been done that have proven that it does not increase the incidence of cesarean. But yet, if you are taking that same patient for cesarean, then this technique can be further extended by giving the further increased dense dose of the drugs so that cesarean can be done, and we can do the post-operative pain relief with this. But this per se does not increase the incidence of cesarean.
सो इट्स अ गुड थिंग अगर पेशेंट उससे पहले पेनलेस के लिए ये ऑप्शन ले एपिड्यूरल, तो अगर सिजेरियन हुआ भी तो वही इंजेक्शन से आप और दूसरी मेडिसिन उसको दे के सिजेरियन भी करा सकते हैं.
Yes.
So it's a beneficial point for a patient who is thinking of getting an epidural analgesia. So
Yes.
have you seen any long-term side effects with this epidural analgesia?
See, there are no long-term side effects are there. Side effects can be backache or nerve damage, because while doing the procedure, patient is already having so much of back edema is there, back swelling is there, and patient is in so much of pain, and it's a blind procedure that is being done. So there can be certain nerve injury, but that are temporary. There was one of my patients who had been given labor epidural by me, and she had some tingling, numbness, and some neurological problem, but that settled within 3 months. I was following her, and that settled within 3 months. So that's a very rare complication. Only just one patient I have seen in my whole career by now, because
In
there is no
18 years.
long-term side effects. Yes, there is no long-term side effects. Back pain or nerve damage, if you say, they are very temporary, and backache is very temporary.
So backache can be due to other reasons also, because I really
Yes.
feel कि एक पतली सी needle क्यों backache करेगी, and it's seen in patients with cesarean also, चाहे उनको GA भी मिला हो, because after delivery most of the time the female is so occupied with the baby, she doesn't have time for herself, तो आपके vitamins भी miss हो रहे हैं. प्लस देर इज अ बैड posture एसोसिएटेड ड्यूरिंग फीडिंग, जो बहुत कॉमन है कि जब आपको लगा एकदम वो बच्चा रो रहा है तो आपको नहीं समझ आया, आपने फटाफट फीड कराना शुरू कर दिया, आप इतना झुके हुए हो, आपकी बैक पे ऑलरेडी अ टोल है, यू आर नॉट गेटिंग इनफ स्लीप. So but there is a tendency, it's a human tendency that we start blaming things, and सबसे easy target उस टाइम पे मेरे ख्याल से एपिड्यूरल हो जाता है कि एपिड्यूरल बैक पे इंजेक्शन लगा था, उसके बाद से अब मेरे को जब से बैक पे इंजेक्शन लगा है, आई गेट पेशेंट्स 8-10 साल बाद भी मुझे यही कंप्लेन कर रहे थे, वो इंजेक्शन के बाद से मुझे दर्द होना शुरू हुआ, उससे पहले मुझे दर्द नहीं था. So
I totally
this
agree with that, because just one injection cannot cause any backache. And even I have got two injections, I've got two babies. So even though matlab, that time I had headache and backache, but still I think that was the best thing I had during my deliveries.
So, what is the most common side effect that I've heard about with epidural analgesia is the BP थोड़ा low चला जाता है, low BP and headache.
Yeah.
Is it there, or how temporary is it?
Yeah, the most common side effect is low blood pressure, but we are already giving the fluid. Once we place the injection, once we have started the medication, we start the intravenous fluid, we start the monitoring of the patient. Patient blood pressure is being monitored, the baby is being monitored. So we are taking care of that. Then headache can be because if there is a further puncturing and we are entering into the spinal fluid, that could be the cause, but that is just temporary, and that is only during the lying time, lying down. It is not. It is not there during the lying down position. Once we get up, it is there. So once I'm in lying down or in a lateral position, the headache is not there. And backache is very temporary. And you can get itching, you can get a little bit of tingling, numbness in the legs. You have got a decreased control of your bladder. You need a support, but that is being taken care, and that are just very temporary, and they just are finished when the catheter is being removed. Once you're off your epidural, all these temporary side effects are gone.
Yeah, so in our guidelines also they say when we get an epidural analgesia, तो आपको वो first जब आपको loading dose लगी तो first 30 minutes the baby and mother should be intensively monitored, and उसके बाद
Yes.
में during the top up also again they should be monitored. So अब मैं आपसे ये पूछ रही हूँ कि एक फिक्स्ड ड्रग है क्या, मतलब अगर हमने डिसाइड कर लिया कि बस हमने 5 देना है, या इट कैन बी कस्टमाइज्ड अकॉर्डिंग टू द पेशेंट्स नीड, and how frequently we can increase, and what is the maximum dose that you think कि बस अब इसके बाद नहीं हम देंगे?
Yes. We choose those drugs that have got a minimal side effects, and we use the concentration, very low dilute concentration that does not cause any side effects to the mother and baby. And with that, the patient can walk. Yes, we can customize, but I have to take care that I'm not exceeding my maximum safe dose of the local anesthetic, and that should not make the baby mother numb. I don't have to make the mother numb. She'll be feeling the contraction, but she won't be feeling the pain. So depending upon their threshold, we ask the patient ki aapko out of the I'll say out of the 10, out of the say 10 scale, how much pain you are feeling now, how much percentage of your contraction you are able to feel, and you are comfortable into that. According to that, we can adjust our loading dose and we can adjust the infusion. But yes, there is a maximum limit up to which I can give my infusion at that rate only, because we have to take care that they are not causing any side effect to the mother and the baby.
Okay. So when do you decide कि जो अब ये पेन प्रोसीजर जो है ये फेल्ड में हो गया है, बिकॉज यू ऑल्सो मेंशन कि इट्स अ ब्लाइंड प्रोसीजर, सो आपने मेडिसिन दी, टिल व्हाट टाइम डू यू थिंक कि अब तक इफेक्ट आ जाना चाहिए था? अगर नहीं आया तो इसका मतलब मे बी द एपिड्यूरल इज नॉट वर्किंग.
Yes, it is a blind procedure and it has got a failure rate of 8 to 10%. And then if I'm there, I'm checking the patient, and after giving my medication, if there is no effect, the patient is not comfortable even after 15 to 20 minutes, I have to readjust the catheter, or I maybe need to repeat the procedure. But maximum I can wait for half an hour till I declare that it is a failure rate. I need to give some other alternative painless method for the patient. Otherwise, I can readjust my catheter and readjust my dose, but maximum half an hour I'll wait.
सो आफ्टर डिलीवरी भी हम उसको कंटिन्यू कर सकते हैं एपिड्यूरल एनाल्जेसिया को, या फिर हमें उस टाइम के इमीडिएटली होने के बाद में उसको निकलवाना है कैथेटर को? टिल हाउ
No, no, it's not necessary that I take out at that time only epidural catheter, because already my needle has been removed during the procedure, and I have put a very thin catheter into the back, and that has been taped. So I can keep easily for 1 to 2 days. Actually, we use that in other procedures also. So it can be kept for 3 to 5 days. But
सो
we
इट्स
don't
इट्स
feel so much of pain after normal delivery. So I can keep for 1 to 2 days.
स्पेशली जिस पेशेंट को सपोज द पेशेंट एंड अप इन फोर्सेप्स और वैक्यूम डिलीवरी, तो स्टिचेस ज्यादा हैं एंड देयर इज सोरनेस, सो इन पेशेंट्स लाइक दैट आप जैसे कह रहे हो एक पतली सी प्लास्टिक की ट्यूब है, इट्स लाइक उतनी पतली जितनी एक आईवी कैनुला भी नहीं है, उससे भी पतली ट्यूब है जिससे वो मेडिसिन जा रही है. सो इट्स अ गुड वे ऑफ गिविंग एनाल्जेसिया टू दैट पेशेंट रादर देन हम उनको टेबलेट्स खिला रहे हैं जो उसके अलग जीआई साइड इफेक्ट्स भी दे रही है उसको, नोजिया, गेस्ट्राइटिस जो कि एंटीबायोटिक से भी हो रहे हैं उसको इंक्रीज कर रही है. सो वी कैन गिव फॉर वन डे
Totally
एटलीस्ट
agree with
जब.
you. Yes.
So that makes a very good choice for a patient if she opts for labor analgesia, because वो उसको post delivery during stitches और उसके बाद भी for one day she can continue that, तो उसको pain relief रहेगा. So आपके
Yes.
accordingly is the pain 100% relieved?
I won't say 100% relief, because we are not making the patient numb. we are using those concentrations that are causing analgesia. There's a difference between analgesia and anesthesia. In cesarean, we are giving anesthesia that are making the total, the body, lower part of the body total numb, so that there can be a cut and the baby can be delivered. But in this case, it's an analgesia. There will be contraction, but that you will be comfortable. Depending upon the threshold, some people usually go to sleep only. Once the epidural is put, they just go to sleep. Some people, some patients are comfortable. Some patients are like, okay, I'm still disturbed. I'm able to feel the contraction. Yes, you will be able to feel the contraction, but you will be relieved of the pain. You won't be feeling that anxiety, fear. You won't be having that, I'll say, disharmony. You won't be feeling that uncomfortable pain, that you will be having those anxiety.
So according to you, कितना percentage, if you take a range, कितना percentage of pain relief उसको उस time पे होता है of taking epidural analgesia if given at a right time?
If given at the right time, yes, 80%, 80 to 90% she will be relieved of pain.
Oh,
Depending upon
nice.
her threshold, but she will be relieved of pain.
There is a question why it is said painless delivery can harm babies. Is it a myth
It
or
cannot harm babies. See, the fact is, it cannot harm babies because it's a gold standard since it's being used since 1960. And there have been lot many studies that have been done that it does not cause any harm to the babies. We have got so many drugs, and those drugs that we are using, they're in just a very small and dilute concentration that they won't harm the babies.
so? Another question is painless delivery safe and doesn't have any side effects?
See, I won't say it doesn't have any side effects because in medicine, everything has got a side effect. Even if you take COVID vaccine, you will have side effects of that. So there is nothing which doesn't come with the side effects. If you are driving on a road, you are not 100% safe. No? See, but those side effects are very mild. I've already told the side effects that low blood pressure, decreased bladder control, headache, backache, itching, or tingling numbness sensation. But all these are temporary. But you have to realize that if you ask those patients who have taken epidural, that it's a boon. It's a boon for a female. मतलब
Yeah.
it's my birthright. I don't want that pain. I want to have a good bond with my baby. I want those good hormones. If I'm having that anxiety, that adrenaline and noradrenaline, if they are secreted, you have to think that 25% of that, if it is there, that is decreasing the blood flow of my baby by 50%. So I want a happy baby. If you want a happy baby and happy mother, so I think it's
and
my
it
right to have a painless labor.
and it definitely makes the obstetrician also very happy because it's a very good feeling जब आपका patient इतना relaxed और आराम से pains में जा रहा है. I remember a patient, we were shifting her for a delivery LDR में for the shifting for उसको epidural दिया हुआ था and we were shifting and she was just waving bye to her relatives and I thought she's going for a delivery and she was so happy with the painless response कि उसको वो पेन नहीं फील हो रहा था उसको लगा था अच्छा ठीक है ये मैं जा रही हूँ मैं अभी आ जाऊंगी वापस so that's the satisfaction and that's the I would say good feeling you get once your patient gets what she deserves and she doesn't have to tolerate unnecessary pain and which she can be actually saved of. So what are the
That is the
advantages?
biggest advantage of painless delivery.
Yeah,
That is
that
the
is the
biggest
biggest.
advantage. I'm not having those adrenaline. I don't have any anxiety, and I'm not shouting. I'm just into my positive frame of mind that I'm passing those good hormones to my baby. I'm not passing adrenaline to my baby. I'm not decreasing the blood supply because once I'm in pain, see my respiratory rate increases, my heart rate increases. You can say whenever you are in pain, your blood pressure increases, your heart rate increases, your respiratory rate increases. What will that do? That will decrease the blood supply to the baby. See, because everything that is going on inside you is passing on to the baby. If all these effects are there with you, that will ultimately going to do decrease uteroplacental blood flow. So ultimately, you are harming your baby if you are feeling all those pain. And if I'm not feeling any pain, see, I'm happy and my baby is happy. So that is the biggest advantage.
So, to complete the session, can you tell us the recent advances in epidural analgesia जो अब है?
See, in the recent advances, there is the walking epidural. It was earlier also, but now they have started combined spinal epidural analgesia. In that, they give a very low dose of spinal, and then that is continued with epidural. So, with that low dose, the patient can walk around inside the labor room and inside her own room, and she can be more comfortable. She's more comfortable in her surroundings. Then there is a dural puncture epidural. In that, there is a dura puncture that we are doing intentionally, but that is to have a good communication between the epidural and spinal space to have a good effect. Then there is a patient control epidural analgesia. In that case, the patient can control her own pain controlling medicine. There is a baseline infusion that is going on, and intermittently you can press the bolus button. Obviously, there is a safety mechanism that you cannot press it repeatedly. There is a dose interval that is there, but you can control. I can control my labor, I can control my pain management on my own.
So that's a really nice way of seeing the things. And I think we have basically answered all the questions. आपने सारे अभी बहुत डिटेल से समझा दिया. And it should become helpful to people who are thinking of getting an epidural analgesia या painless delivery जिसको वो बोलते हैं, उसका option to consider. So you have given them a neutral mindset जो कि एक आजकल Google generation से बहुत ज़्यादा affected रहता है. So, what is the cost of painless delivery and how is it different from C-section? This is the last question of our session. So, we'd really like to know.
See, cost of painless delivery depends upon the hospital to hospital, nursing home and their setup, and how it is different. So this is a natural method. Painless delivery that is happening, it's through the natural way through vagina that is happening. It's just that it is being medicated. Okay, cesarean section is that you have been the mother is being taken to an operation theater. See, for painless labor, we are not shifting the patient anywhere. But for cesarean section, we are shifting the patient to the operation theater. There is being cut that is made into the lower abdomen, and through that the baby is delivered. So the total surrounding is different, the total method is different. Okay, if that patient has got an epidural in C2, I can continue that for cesarean section. I don't have to give any other further anesthesia for that surgery. But that is a surgery, and the previous one is a natural way of delivering the baby, is that it is being a medicated way. Otherwise, it's a natural painless delivery.
So actually, अगर देखा जाए तो epidural analgesia has increased the number of normal deliveries rather than patients pain tolerance अपनी की वजह से cesareans करा रहे हैं और जो हो रहा है उसकी वजह से it's a good option for them and it helps them to get a normal delivery and normal delivery के advantages हैं आप immediately खा सकते हो खाना जो मुझे लगता है सबसे एक important है because we always say कि अब आपको 24 hours we are not able to give you more anything. So how many C-section can a person have? It's a question from Jyoti. So basically, patient can have C-section up to 3 or 4 also. But depending upon every C-section में आपका strength of the scar gets weakened. So usually we don't advise them and हम 2 के बाद में जो third section होता है उसमें उनको advise करते हैं कि आप permanent method कर लीजिए because every time the uterus में जहाँ से वो कट रहा है वहीं से दोबारा stitch हो रहा है the scar gets thinned out और वो weak होता जाता है जैसे जैसे वो weak होगा next pregnancy में वो अपने आप rupture भी हो सकता है which can become a dangerous condition for the mother and the baby. So I think that answers the question. Thank you so much, Dr. Neeti, for the interactive interaction today. And I think हमारे सारे जो लोग जो आज हमारे को देख रहे हैं और सुन रहे हैं, they might get some benefit from it, and it will be worthwhile for them. Thank you so much.
Thank you so much, Dr. Gunjan. But I think this is a boon and a birthright of a female to get a medicated and painless labor.
Yes.
And
yes.
thank you so much for inviting me for this touchy and beautiful talk. Thank you so much.
Thank you. Okay.